Peter Parker is a 9-year-old male who was diagnosed with osteogenesis imperfecta, commonly referred to as brittle bone disease, at the age of 7. After breaking 6 bones while doing regular everyday activities and falling like a normal human being would, he was still breaking his bones, and very badly. After those 6 breaks, his parents realized something was not right at all. After talking to their orthopedic doctor about their concerns, he diagnosed Peter with brittle bone disease.
So, Mr. and Mrs. Parker, with this disease, your son will live a perfectly healthy life, but he will have to be careful. You see, Peter's disease is caused by a defect in the production of the protein his bones are made of, causing them to be weaker.
Just like any newborn child, Peter's parents took him to get checkups with his primary care physician, Dr. Seekley. After breaking a bone trying to crawl at 10 months old, they thought it was abnormal, but just thought it was a dysfunction. For a while, Peter was perfectly fine and didn't break any bones. But then, once June of 2015 came around, when Peter was learning how to ride his bike at the age of 5, he was trying to ride his bike on grass. Peter barely fell over and broke his ulna very badly. After crying for a long time and getting x-rays taken by Dr. Longmire, he was put in a cast and was healed up in no time. Although, when September of 2015 came around, Peter was rear-ended by a car and even with his seatbelt on, hit his head on the window and fractured his skull. After rest and taking the right precautions, he was also able to heal his skull. At the age of 6 in August of 2016, Peter was hit by a car while riding his bike and fractured his C8 vertebrae. While this is reasonable for Peter to be very concerned about his health, anyone without brittle bone disease would have also fractured this or have had some other kind of terrible damage done to them. Peter, again, got an x-ray taken by Dr. Longmire and immediately had to go see Dr. Dunwick to have spinal surgery. Peter did and will always have permanent nerve damage due to the spinal injury. January of 2017 rolled around and Peter had a snow day. And Peter went sledding, slipped on ice, and fell into a pile of snow and broke his tibia. This seems normal, but it was abnormal because children do this sort of thing all of the time. It's not normal to break your tibia while slipping on ice, but falling into a nice fluffy pile of snow. Once again, Peter was all casted up and was back to normal just in time for baseball season. The final bone that Peter broke before being diagnosed with brittle bone disease was his 5th tarsal. While fighting for Halloween candy, Peter jammed his finger into the bowl, and his finger was broken. Any other child without brittle bone disease would have just stubbed their finger and said that it hurt. After breaking this final bone at the age of 7, Dr. Seekel referred Peter to Dr. Labator, an orthopedic doctor, to go deeper and discover what was really wrong with Peter.
November 15th, 2017, 1:27 p.m. Just completed first appointment with Mr. Peter Parker, age 7, chief complaint of easily broken bones. Medical history shows 6 breaks to date. Mother claims all ultrasounds were normal during pregnancy and no fetal diagnostic testing was done. Skin punch biopsy was ordered for diagnostic confirmation of osteogenesis imperfecta. DNA testing was ordered for potential causes. November 17th, 2017, 8:38 a.m. All diagnostic tests for Mr. Peter Parker are in. Skin punch biopsy proves easy bruising and bleeding, confirming osteogenesis imperfecta type 1 diagnosis. DNA results came back negative for relative genetic markers, allowing the assumption of the cause to be a mutation. November 21st, 2017, 10:59 a.m. Second visit with Mr. Peter Parker completed. Patient and family have been informed of type 1 osteogenesis imperfecta, official diagnosis, and treatment options.
They decided that Peter should go into physical therapy to strengthen his bones, take a bisulfate medication like adrenalate, to help strengthen Peter's bones, take pain relief medicine like acetaminophen, only participate in low-impact sports and exercises, and in the worst case, have rod implant surgeries. When Peter was 8, he went on to get hit by an 80-mile-an-hour baseball and cracked his 5th rib. Later that summer, Peter was riding a motor scooter with knee, elbow, and shoulder pads on and was also in the grass. But, yet again, he broke his right patella and his right clavicle. After that, Peter was playing catch football in his backyard and not wrestling, and fell trying to catch the ball and broke his 5th left metatarsal. Finally, 4 months ago, Peter broke his left radius while wrestling and roughhousing with his older brother, even though it was very gently roughhousing. With the help of innovations such as casts, crutches, x-rays, medications, boots, Peter was able to heal all of his broken bones as soon as he could and make sure that he is getting better in every way possible. While brittle bone disease is not a horrible disease to have, it is still a pain to keep breaking bones. With as many as 50,000 cases a year, there is a 100% survival rate. Peter's final decision with Dr. Labrador was to regularly take adrenalate, take it easy on heavily impacted sports, have rod surgery at the age of 11, at the latest, in places such as his wrists and spine. To make sure to go to the doctor when needed is also very important. To make sure Peter is up to date on all of his medications and maintaining to take care of himself.